Welcome back, and it's time for our Plastic Surgery Today segment with our sponsor, Bay Area plastic surgeon, Dr. Stanley Jacobs. And today, we're talking about noses.
Right.
Not the old nose necessarily, the new nose that has to be fixed.
Right. So we're going to talk about revision rhinoplasty.
Yeah.
The fixer-upper.
The fixer-upper, because, you know, but here's the thing, is it must be hard for patients, because you go in once, and then to have to do it again.
The psychology is big. For them to actually show up on somebody else's doorstep a year, 2 years, 5 years, 10 years later, whatever, depending.
Is it much later? Because does this happen, like you get the nose job, you're happy, and then suddenly it changes? Could that happen?
It does, not that sudden, but it can it'll happen over months, but it could happen within 6 months, or it could happen within 2 or 3 years later. So that's why when you're doing rhinoplasty surgery, it's like building a house. So you need a foundation, a structural support. If it just looks good on the outside, that's not good enough in a house, it's not good enough for a nose. And you know, you've seen a skull where they just have, all it is a bone and a little thing up there and everything else is missing. That's because that's cartilage and skin and connective tissue. Yeah. So you have to use that and build that and rebuild it. So if you're taking a bump off a nose, for instance.
Yeah, I was just gonna say, so like I have a bump in my nose and it's not my bone, it's the...
It's cartilage.
You can see it on that side. Yeah.
Right. So if you take off too much, then you can affect the structure and it could sag and collapse, because the structural integrity of a nose is important. So like, for instance, we have a couple of patients to show.
I heard that as you grow older, your nose... Is it true?
No.
Is it true? Your nose doesn't keep growing and it gets bigger when you're older?
No, but it sags. The ligaments that hold the cartilage right together sag and they stretch, the nose falls.
Okay.
It lengthens, it gets bigger, but it doesn't actually grow like...
I just thought, oh no, how big is my nose going to be when I get older? No, not really. Okay, good. Good. Thanks for that. All right, so here's this beautiful woman. Oh my gosh, look at her. All right, and her before and after. So what happened
So
here?
years ago, she had a rhinoplasty, and it's not that obvious in this picture.
Looks okay.
It looks okay, but the tip at the bottom's hanging lower, and the middle part above the tip is actually narrowing, and she's having a little trouble breathing in this case, too.
That's a problem.
So they have...
You want it to function.
You want it to function. So there's this narrowing, because too much cartilage was taken out in the middle part right here, right where you're touching. Yeah.
I'm just seeing if it's me,
So, and she didn't like the little bumps at the top either. It was a little uneven.
Right.
So what I did was I took cartilage from her ear and put it in her nasal tip to rebuild the tip, because there's almost no cartilage in her tip left.
Wow.
And then I took, because she has very thin skin.
Did you go in? There's no scars on her, right?
There is, but you can't see. It's a little one underneath the nose.
Okay.
And then I took some septal cartilage to put, we call spreader grafts, in the middle part, like battens in here, to go inside here, so it wouldn't be pinched in here. It would fill that in. Thin pieces of cartilage.
Now that pinchy thing, I remember back in the day, there were basically 2 nose jobs, and my aunt has, and her kids all have the same one.
Because they take out too much of this cartilage.
Oh, and they just, like Michael Jackson has a pinchy thing
Well, he's got almost no cartilage. He has a plastic graft.
Yeah.
I was on
Can you fix that?
I was on CNN for that show.
Can you fix that? Could you fix Michael Jackson's nose?
Yeah.
But you'd take ear and you'd take stuff.
You'd have to take all kinds of grafts to rebuild it. Bone, ear, whatever you need to rebuild it from scratch. It's like having a skull and building it from nothing.
Now, I think, here's your other one. I did see a little pinchy going on this before and
her
after.
nostrils also are distorted. You see, they're kind of...
It's hard to make them even, right?
Well, that's what we're trying to do with that surgery, is to make them even, and the proportionality of the hanging part at the bottom.
Yep, the hanging part.
Mix with the side. You see the side view?
Yeah.
There. Too much nostrils being shown. Yeah. And they took out too much cartilage on the top, and what happens, it pulls the nostrils up.
Okay.
It pulls it up because a lack of cartilage on the side here will pull the nostrils up, because there's no supporting them. Right. So I had to put cartilage grafts to push the nostrils down. Oh my gosh. And then lift the bottom part up to make that angle. Are you still breaking anything to do that?
Nothing. So do these corrective ones come with bloody,
no, no bruising.
No bruising?
No.
No black eyes?
No black eyes.
Oh, nice. Okay.
No.
Great. And are they half the price? Just kidding.
No, they're more.
They're more? Are they more?
Yeah, it's a pain. 3-hour case.
Wow, yeah, okay. Yeah. So I guess in the first place, go to the right person, because that would help. You don't want 2. Right. You don't need 2 nose jobs. One's enough.
One's for life.
And what do you got going here? This is a whole informative thing?
Tomorrow I'm having a lecture. Now, it's in Healdsburg. If people can't make it to Healdsburg, we're going to make DVDs. We're actually videotaping it, and we can send DVDs to people that can't make it.
Very good. Thank you, Doc. Go to drstanleyjacobs.com for more. We'll be right back.